And we have our wonderful discussant, Dr. Jennifer Bouey. She is an associate professor and chair of the Department of International Health at Georgetown University, and she will introduce her fellow panelists.
Thank you. I know it's always hard to get people back after lunch. Especially with that beautiful courtyard. Don't you like our courtyard and the water yellow? Yeah, so it's a really great season to be here. And I appreciate that you're coming back to our room because we have a fascinating panel coming up. And this is the only panel before the break. So after we're done, we'll have another break and you can enjoy the sunlight again. So we have four group of speakers for this panel. Because of the presentation, the lens, we will invite them up to one at a time. And then after their presentation, we'll have enough time that I will give a few questions. So then we'll come to sit in the front. And I will make sure to make plenty of time for you to ask questions, because I think usually that's the most interesting part of the interaction between the panel and the audience. Okay, so our first speaker is Ms. Suchan Rossmark. She has 35 years of experience in the entrepreneurship. She owns multiple business, restaurants, and real estate and financial services. But she's also the board chair and interim executive director of AALEAD. That's Asian American Lead organization. And in this capacity, she has expanded programs and partnerships, and she has driven the community engagement, advocacy, and growth. And she also served on the Governor's Commission on Asian Pacific American Affairs and Montgomery County's Asian Pacific American Advisory Group. Welcome, Ms. Rossmark.
Thank you so much. I did it. Great. Good afternoon. I know I'm in a challenging spot right after lunch, so I have done no boring slides, and I'm going to try to keep this as sort of informal and kind of open, more of sharing some of the stories and my experience. Couple things. I have now graduated to the full-time permanent executive director of AALEAD. So I actually have been connected to Asian American Lead. And so I first want to explain what Asian American Lead stands for, because most people don't know. LEAD stands for Leadership, Empowerment, and Development for Youth and Families. And so when we started about 27 years ago, we did a lot of outreach with families because we were initially started to help the Vietnamese refugee community that was in the DC area. And so where we've expanded to in 27 years is not just Washington, D.C., but we've expanded to Montgomery County, Maryland, and Northern Virginia. So we've really started with this thing of helping Vietnamese refugees, and where we've grown to is serving about 23 different Asian American ethnicities. I would like to say that we're probably one of its kind in this DMV in terms of doing that type of work with youth. And so how do we help youth? How do we impact youth? We actually go into the school systems and we run our after school care there. So when you think about, youth that are coming out of school, where do they go, right? And so they really can come to AALEAD. That we're in middle schools, we're in high schools, and our team, actually, I like to give a big, can they wave, Michelle, Susie, and Dr. Day. Our team is also here to kind of, support, learn as well from all of you. And they're sort of the boots on the ground that do all of the hard work with our youth. And you'll actually this afternoon get to hear from one of our youth. So AALEAD is very committed to making sure that youth voices are heard. And that's why when I had the privilege to be asked to speak, I really wanted to like share with you some of my experiences working with our youth. And those stories will also share with you some of the achievements, but also some of the challenges that we've sort of encounter from that perspective. So as Jennifer shared, I have been in the for-profit area. So that's been about 30-something years. So transitioning to nonprofit in the last 2 years has been a really different experience. And I will say that I'm actually signed up to attend Georgetown's nonprofit leadership executive certification in June.
Business school.
Yes. So I'm sending myself back to school too, because I always feel like I could always learn more, right? And you always want to make sure you're resharpening the saw to make sure that you're, staying kind of cutting edge to what's happening in sort of the area. So, but one of the reasons why I joined AALEAD and why I'm so connected, I've been a part of the organization for 17 years. So I started out just volunteering, and then I became a donor, and then I became a board member, and then a board chair, and twice interim executive director. So I sold my restaurant about 2 years ago, and I was doing that, soul searching, trying to figure out what I'm going to do for this next part of my life. And then, of course, our executive director, he gave us plenty of notice that he's said he's changing paths and we love him to death. And so the board was like, Sue, why aren't you going to help out? And next thing you know, while I was helping out, they're like, you need to apply for the position. So I will tell you that they didn't just hand me the position. I had to work for it. And we hired an independent search firm so that it felt very I think fair in terms of the fact that I went through 5 interviews to get here. So I am really loving the work that I do. I like to also share that I think, for me, I'm just not the ED that works in the office, sort of doing all the grants and administrative. I love is being out in the field with the youth. AALEAD really added mental wellness work about 4 years ago. We saw the need. The need is so great, especially after COVID. If you had a youth that was and I think a lot of Asian American youth are already quiet. We already struggle a lot with our identities. We struggle so much with getting the support at home and building their confidence. And so then when COVID happened, most of the youth got even more isolated. And then all of a sudden, we were told, isolation is over, come out. I think that's really a hard challenge. And depending on where you are in terms of your age and where you are just, academically and in your development. So we saw the need. We have actually continued to grow our mental wellness program. And so one of the things I would like to share, I've been around, I would say, in this sort of interim ED role for about 2 years. So I started to go out and work with my team when we do the mental wellness workshop. Last year, we ran 4 workshops, all 4 included youth, 1 included a parent. So I'm going to share with you some feedback on that. But I'll tell you what I'm finding out, what I'm seeing and experiencing with our youth. They are so feeling the pressure to succeed. And it isn't just coming from the parents, although they're getting it there. It isn't just coming from the grandparents, because Asian Americans have multi-generational households. It's also coming from themselves. It's coming from their friends. And we sometimes, as maybe the educators, the caregivers, the parents, don't even realize that your kid's going through that. And so that's one of the things I'm really proud of the work we're doing. We're helping them to understand how to cope with some of the changes, some of the stresses, some of the pressures, letting them know where the resources are. I think I don't need to tell this group, right, that suicide is the number 1 killer among Asian Americans, age 14 to 24. And personally, I had to help a family last year whose son was like 22 years old and killed himself. And there was no warning signs. Parents didn't speak English. They didn't even know how to navigate, as sad as it sounds, how to get his body back from the police. So when you think about Asian Americans and the ways that we struggle, the language barrier is hard. Where are the resources for the parents? This is why last year I sat in the parent session as well. So different sessions and different workshops we had. I was shocked how the room full of parents were all raising their hands. They were asking questions. They were engaging. They were sharing personally their struggles growing up as a youth, as an Asian American youth. I can share with you my struggles. I struggle with identity so much. I grew up in DC public schools, and we were very low income. We didn't have any money. We didn't have any resources. I honestly back then didn't know that Asian Americans went to college or that they were even Ivy League college with Asian Americans attending it. We grew up in a very poor sort of restaurant business, which is what I said I'd never do when I grow up. Well, if you don't have a college degree and you didn't have role models, how were you going to be anything else? So I did exactly what my parents did, which is open a restaurant. I was 18 when I opened my first restaurant. Okay? 12, 14 hours a day, 7 days a week. That's all I knew. I knew how to make money. But I really didn't understand all of that. I'll probably be the first one to confess. If you talk to my kids, they'll tell you I was a terrible mother. I parented exactly how my parents parented me. This is something we all need to be aware of. We can't do different than what we don't know and what we don't see. And that's why I do think parents are struggling with how to parent. Because my parents did all stick approach. There was no carrots. You know, it's either do this or else. And there were a lot of or else. So I think for me, like one of the reasons why I worked hard, pushed myself was because I didn't want that for my kids. But then when I had kids, I was a little rough. I was a little abusive. I will confess. But my children, I think, are totally getting the benefits of me working at AALEAD. Because I've learned I have to adjust myself. The more stick approach I do with them, the more they fight back. And the more now that I try to open myself up to listen, I may not always agree with them. Be honest, a lot of times I don't. But I try to curb it a little bit or really think a little bit different about how I may just react very quickly. These are a lot of the struggles that I'm seeing out in the field. I had a parent call that talked to me maybe about a month and a half ago. And the parent said, and she was crying. She was very, very upset. She had the only boy, had many other girls, but that was her only son. Her only son's not talking to her. Mm-hmm. And she's crying. She's going, I don't know, what did I do wrong? I gave him everything. Everything. And I said, you didn't do anything wrong. You didn't do anything wrong. You parented exactly how you knew how to parent. Most Asian American parents think if I give you shelter, college education to pay your bills, roof over your head, like we're showing you love. We didn't know you're supposed to say, I love you. We didn't know that you're supposed to say, oh, I really care about you. We really didn't know we're supposed to spend time with our kids and sit down and listen to them. This is the shift. This is the shift. And so when I talked to her, she's like, I did see your promotion, Sue, on that mental wellness and that psychiatrist or someone you have coming to your program. Should I just call her and make an appointment? I said, well, why don't you come to our workshop? Why don't you come to our workshop first, see how well you connect with her, you know, and really like take some time, take a step back, and then really saying to her, like, you know, I know you're hurting, but you're feeling like your son is rejecting you. Maybe he just can't handle right now being around the family and you as he's working on him. Think about it differently because you're feeling like you did something wrong, but you really didn't. And so she did come to our session. And, these are sort of, I would say, the ways that we at AALEAD are trying to change what we do to meet the youth where they're at and meet the families where they're at. From last year, having 4 mental wellness sessions, all that had youth in all of them and only one parent, we changed this year. We did 6 sessions. All 6 included parents. I'll tell you one of the biggest challenges I feel is we don't know how to get more parents to know about us. Mm-hmm. I almost feel like, we get really great speakers, professionals there to help, but we just don't even know how to fill more classrooms. Part of that is the language issue. Some of the parents that are hurting don't know how to speak English. And to be honest, we don't have the funding to be able to give it to everyone in all the different languages. Interesting, our last session, we actually had an African-American family. They're from Africa. There was a woman, the parent, came up to me at the session with her 2 boys. And she goes, I heard about this. She didn't expect that it was all mostly Asians in the room. And she goes, oh, I heard about this on the loudspeaker, at the school. They were talking about this and we got the flyer. So I registered. And she goes, I didn't know it's really kind of Asian American group. And I said, oh, no. We're inclusive. We're inclusive of everyone. You are so welcome here. She goes, well, I did go to this was toward the end of this session. She goes, I went to the parent session. The kids were in their session. She goes, I was shocked to find out I wasn't Asian, but it was it all related to me. I connected. And I said, yeah, it's supposed to be that way. We may not all look exactly alike, but our struggles are the same, right? And I said to her, I want to make sure you take advantage of our summer program. She goes, yes, I'm going to make sure my 2 sons sign up for our summer program. So AALEAD also has a 5-week summer program that we do 4 days of just youth programming and 1 day where the youth goes out on a field trip. And sometimes the field trip could be related to things we're learning, but sometimes it's just so you could be a kid. Just so you can have fun. Because I can tell you when I grew up, and again, you got to think about the community we're helping. The community we're helping isn't the ones that can just afford to go on these luxurious vacations. The community we're helping are kids probably that grew up like I did. I never went on a vacation. My parents worked 7 days a week in the restaurant business. When were they going to close their business to take me? They were not. We worked every day, and we used to love Thanksgiving. Thanksgiving was the one day the Chinese restaurant would close. We were also open in Christmas. All the Jewish people came out in Christmas. So you couldn't close on Christmas. And when we closed on Thanksgiving, then somewhere these last few years, they changed. Everybody starts opening on Thanksgiving. It's horrible. But that was the only day I look forward to in the whole year. We didn't have the money for vacations. AALEAD makes sure youth can experience these things, going on the field trips, having the vacations, because we might be the only ones that they think of and remember. So, really talking about what are we doing? How do we make sure we reach more people? I would say you need language access. You also need to get into getting into the area of trust. You're not going to be able to get more parents to sign up if A, they don't know about it, and 2, they don't feel they can trust. Asian Americans, we are so scared to talk about mental wellness. It's a bad thing. You try to pretend that it doesn't exist, or if your child has some sort of issue, let's just keep it quiet, right? But honestly, we need to talk about it more. And there's also different levels. Just because a youth is different doesn't mean they've got mental problems. That's also another big thing, right? I can tell you, I was always a black sheep. Always a black sheep. Because when you went home, you try to share some of those different ways that you're learning. In American school, they told me I had rights. That you don't have rights, not in your household. So I will tell you that we probably really need to and I say this we in terms of my staff, we are thinking ways of how to really get into the communities where parents are to let them know that this exists and where the help is, where the resources are. So that's what I think needs to really happen. We also need to advocate together. I will say just in Montgomery County, Maryland, the Asian American population is 16%. Okay? And yet we don't get 16% of the funding, but we're paying 16% into taxes. In Montgomery County, and I know their numbers well, so I just pick on them because I'm on the county executives advisory group, and I'm like, why the hell aren't we getting more money? The biggest pot goes to that community, the second pot goes to the Latino community, and we are unseen. Because we all work hard. We never don't work hard, but we're working hard in our own separate groups. This is why I love the fact that we're together here in this space. We need to stand together. We need to work together. And don't also look at yes, you and I might be competing on the same grants, but that's okay. Sometimes you win it, sometimes I win it. We need to stand together, be strong together, because only together, I think we can really do some big things. I think that's about it. I'm going to turn it over to the next person and happy to take your questions later.
What a powerful messages. I really, really like that. I know many of you will want to talk to Sue and you have questions. So we'll wait a little bit until the next three presentation is done. So in this panel, we have, two groups that actually working with multiple, Asian American, Pacific Islander groups. And we also have, the communities that specifically, delivering to the recent immigrants and ethnic groups. So our next speakers are from the Korean Community Service Center, KCSC of Greater Washington. That's right. So we have two speakers in this session. We have Yong-sun Park, who is the director of the health services, and she has worked with the community organization and oversees public health, mental health, and health equity programs. And before she worked at this community organization in 2018, she worked as a journalist in South Korea for 8 years. So she has a strong skills in advocacy, storytelling, and understanding the community needs. We also have Hwan-sung Hutchinson, who is the Senior Mental Health Program Coordinator at the organization, and she has she's specialized in marriage and family therapy. So welcome to the podium.
Good afternoon, everyone. My name is Hyun Park. I'm the Director of Health Services at Korean Community Service Center of Greater Washington. She introduced me a good communicator. Does have good communication skills as a previous journalist, but because of the language barrier, I'm not that much confident. But yeah, please excuse me. Just 10 years ago, I came to the U.S. because of my spouse, the career. And I want to introduce me as a first generation immigrant. So that's why this job is slightly different from my previous career. I'm so passionate to deliver the community needs, and I want to contribute to make it a healthier community. And let me introduce myself.
Good afternoon. My name is Kwangsuk Hutchinson. Before I work here, I was in Korea And then I came back to the place, and now I'm working as a mental health coordinator, and then also mental health professional. And so I am happy to be here and meeting you all, and then excited to present. Thank you.
I would like to share a brief introduction of KCSC. KCSC has been a trusted presence in the DC metro area of over 50 years. Actually, this year we are celebrating our 51st anniversary, serving as a lifeline for thousands of immigrant families. When our community members face financial hardship or housing issues, domestic violence, or emotional challenges, they often just come to us first. That's because they know us for a long time, and more importantly, they trust us. We offer one-stop services, including social services, victim support, and health services, including mental health support. We do have 5 service locations, and the headquarters is located in Annandale, Virginia, and we have a Centerville office, and we have 3 branch offices in Maryland, Gaithersburg, Silver Spring, and Ellicott City. One of KCSC's greatest strengths is our integrated referral system. This model was built not just for the efficiency, but for compassion. Many of our clients come to us seeking help with social benefits, such as food assistance or rent assistance, or to apply for Medicare, Medicaid, Obamacare supplemental income. But they, or sometimes the domestic violence victim, seek for help, for legal advice or one-on-one case management during their divorce journey. But as we walk with them, we often uncover deeper, unspoken needs, mental health challenges that have long gone unsupported, and they don't even aware. This is where our integrated system becomes essential. A client who begins with the social services can be gently referred to mental health support without stigma or having the process to tell their story again and again to the new system. Similarly, someone in our victim services who is navigating trauma and abuse, they can be connected with, of course, DV case management with legal service, but also they can be connected to individual counseling. We ensure to see the whole person and to provide whole care. On average, we serve around 12,000 unduplicated clients every year, and our integrated and culturally grounded and trusted support is the key to long-term healing and empowerment. So I want to share some service number. This is from last year, from January 2024 to December 2024. Social service is one of the key program we provided from the very beginning of the organization, started in 1974. So our phone counseling number is over 2,000. And one-on-one case management number is over 5,000. You can tell how our social service coordinator always busy to serve our client. And for the DV victim services, our number is the 110 on cover. Sorry. Is case management, and we do the domestic violence prevention seminar through the program here. So it's 133. And we often provide a healthy marriage workshop to make the couple healthier couple relationships. So we conducted the workshop to 394 unduplicated clients last year. And now I'd like to highlight one number in particular. You see 706 mental health counseling clients number, which is unduplicated clients were connected to our counseling.
Now I'd like to talk about our mental health program offers. We offer bilingual counseling service in both Korean and English, and we provide in-person sessions in Virginia and Maryland, as well as online sessions. Our team includes 7 mental health professionals and 2 licensed counselors. We hold monthly supervision and small group meetings to ensure quality care. Each month, we provide around 100 to 150 counseling sessions. Additionally, we are grateful to have 2 volunteer psychiatrists offering free services to low-income residents in Virginia and Maryland. And we provide a wide range of counseling services for all age groups, including children, teens, adults, couples, and seniors and families. For children, we also offer art and play therapy. We support clients with parenting programs, parenting concerns, and relationship issues and trauma, including domestic violence. As of 2024, about 60% of our clients are from Virginia and 40% are from Ireland. We address a wide range of mental health issues. The most common concerns among our clients are depression, anxiety, and family conflicts, followed by grief, anger, and various forms of abuse, including emotional, physical, sexual, and financial. In terms of our service type, nearly half of our clients receive individual counseling. We also support couples, parents, youth, children, and seniors through tailored counseling services.
Now, let me share one of our client story that really shows how our service come together to support the whole person and their family. This Korean woman is a single mother and initially came to KCSC seeking the financial assistance, not mental health support. So she wanted to apply for safety net program, which is financial assistance to pay rent, food, and utility. So through the intake process, some deeper situation revealed. So she was defrauded by sister, her own sister. So she faced the eviction risk and a significant financial hardship. So she remained hopeless and attempted suicide. So fortunately, she was rescued by her own daughter and received emergency medical treatment. She hospitalized for weeks and recovered. And when she was discharged from the hospital in mental health unit, the doctor ordered to take some medicine. But because of the lack of awareness and knowledge, she ignored doctor's note and order a recommendation, and just she wanted to seek some financial support from our organization. So we gently explain about for our services and program and connected her to the available social services, including the financial assistance. And now, fortunately, she is connected with our mental health counseling and free psychiatric service. And she promised us to start the taking medicine, depression medicine again. And also her daughter was connected to counseling support. So we kind of realized how the community awareness on mental health is not existing enough, and because of the cultural difference, she ignored what's the significant problem about her mental health, and ignored the doctor's advice. So through the holistic intake process, we kind of educate her and raise her awareness on mental health, and was able to connect it with various holistic available social services, including mental support.
By the way, even though we don't mention about their name, but we got consent form from them, so they know that we are sharing a story. Okay, so you actually mentioned about the generation gap and then conflict, and we do have that. And this case will tell you that what is about the generation gap. Okay, so this case involves an immigrant family of four young daughters, ages between 3 to 9, who lost their mother unexpectedly. The case was referred by parents liaison from Montgomery County Schools. KCSC work in close partnership with the Montgomery County Public Schools to support the immigrant family like this. The father is a 1.5 generation Korean American, and the grandparents, who are first generation immigrant, serve as the children's primary after-school caregivers. The family struggled with emotional tension across generations, including cultural expectations to surface grief, and a father feeling helpless due to his own emotionally restricted upbringing. To support this family, the KCSC mental health program mobilized the following resources and efforts. So we initiate individual counseling with the father and introduce the play therapy and art therapy for the children to express their emotions safely, and gradually engaged the grandparents, and starting by phone and later through in-person sessions, because the grandparents, they didn't believe counseling can help this whole issue. So what made this progress possible across 3 generations with the different languages and cultural norms and developmental stage was bilingual counselors and child-centered therapeutic approaches like play therapy and art therapy, and a culturally sensitive, trauma-informed team approach.
Yeah, the next client is story about a senior woman who was suffer from domestic violence. So KCSC often conducted mental health seminars and workshops to raise the community awareness on mental health. And we are collaborating many Korean and Chinese churches in the community. So one day we conducted a senior mental health seminar at a large Korean church. And after the seminar, one of the attendees approached her actually, asking some help. And she also ask it's going to be expensive to be connected with the counseling sessions. And fortunately, we were able to explain we are funded by Montgomery County in Maryland, and we can provide free counseling sessions for her. And she kind of relieved about the financial burden. And through the intake process, we reviewed her like a domestic violence hardship lasted over 40 years. Yeah, during her marriage, verbally and psychologically and physically intimidation. And, like in Korean old saying, we do have this phrase, a woman should remain or die in her marriage, no matter what. It means like you have to endure everything, no matter what. That's often her father said to her. So she just like stick to like her father's teaching through her marriage. So during her marriage, she attempted 3 times of suicide, but she endured and endured. And now she's in her 70s. And her children all grown up and adults, and she expressed now she desire to separate from her spouse and seek emotional healing for herself. So we referred, we connected her individual counseling sessions and gently referred to domestic violence division to educate her on her rights and get some legal advice as well. And we connected her to community information and resources. So this was possible because we offer one-stop services, as I explained previously. So, and also because we are one of the trusted nonprofit organization in the community, she was able to open her story to us. So that's kind of like a strength of our organization, I believe. So here are some of our client testimony, and I would like to share some of those. I had never thought therapy was for someone like me, but I realized I deserve support. KCSC's long-standing presence in our community and their culturally respectful approach gave me the courage to ask for help. And I'm grateful for an organization that sees the whole person, not just the problem. So all of our clients feel safe with us and feel great, kind of respectable at KCSC.
Here's what we need to grow. Sustainable funding to ensure that no one is left behind due to financial barriers. We must secure sustainable funding so mental health service remain accessible and uninterrupted. Currently, KCSC relies entirely on government grants. Without diversified funding, these critical services are at constant risk of being discontinued. And second is our outreach in education. And stigma remains the greatest barrier, so we must strengthen our outreach and education effort to raise awareness and improve understanding of mental health. Lastly, partnerships. Collaborate with faith leaders, schools, partner organizations, and government agencies to provide integrated, community-based care.
Yeah, thank you for listening. Thank you.
Thank you very much. As an epidemiologist, I really like the pie chart and the table, but it does give us a sense of what is the workload, what is actually happening day to day in our community organizations. So we are actually shifting our program a little bit. So we'll have Elizabeth. You are the next. Yes. Our next speaker is Elizabeth Cheung, and she's the executive director of the Asian American Center of Frederick. And Elizabeth is the founder and the director of this center because he grew this organization 35 years ago from one person, you, to now they have 35 employees and more than 200 volunteers. And with this dynamic group, that this AACF has a capacity of 40 languages. 60, okay, updated, and represents more than 25 countries. I assume that means your volunteers and staff are representing people from all different
employees and contractors.
Okay, wonderful. Yes, and you focus on minority health as well as immigrant support, right? Okay, all yours.
Thank you very much. Aquí en right? Ni hao. Hola, ¿cómo estás? So, good afternoon. I think that, I can claim my age. Because except my older brother, Toro, he's 2 months older than me. Nobody is 70-some plus, right? So you are my, younger brothers, younger sister, and nephews, and grandkids. So, okay, so set the stage. This is old grandma talking here. and my niece, Sue, and then also Kate. So good to be here today. What I want to do is that it's not to tell you what I do, but it's really helping to share with you how I did it. This is actually my 4th agency. So 3 of them actually in Ohio, and one is in particular is Asia. I don't know how many of you heard about Asia. Asian Services in Action. So this is in Akron, Ohio. It's still doing well. But what I want to do today is it's very important this morning that we talk about, and I'm not going to go into that, but I think Ms. Potter, you talk about the yellow pearl, you talk about the discrimination. So please know the history of our communities, all these 250-some years. And also know the history of other ethnic minorities. So we have to build that, that collaboration together. So I'm going to just share with you, the how as much as I can. Next. By the way, this is Mariam, and freshly from Afghanistan. I love young people working with me, not for me. But I told her that when she came over here, and I have 2 other staff, that Julie raised her hand, and also these are the next generation. So I said, learn something in here and go get the funding. Tell me what you want to do. I'll do it together with you. And that's how I did it with my agency. So my first name is Equities. My middle name is Equities. My last name is Equities. I hate Elizabeth. That reminds me of being colonized. You understand that? So this is really painful, right? Growing up in Hong Kong for, 70-some years ago. I came here in 1970. I give my age away to you too. So it's really hard for 55 years, going through all those tribulation. When people slapped me on one side, you gave them another side. But you're persistent. So happy to really continue to do that. I'm not retiring, no way, right? So continue to give what I can give. So enhance and the arts, it's kind of like typing. These 3 words is every single day of our work, all right? So think about that. You do healthcare, improve access to services, right? You train your folks, community health workers, so they train them to go to do the services, and then you enrich them with, your cultural competence and so forth. So you got to do things in this manner. I mean, I do. So it helps. So, and they see that they're so happy. It's 18 years of health fair, over 1 million for one day. Why? It's 1,000 people that we usually serve, head to toe, no appointments, no billings, no insurance. And it's about $1,000 each. Everything free by collaboration. So 1,000 people for $1,000 is $1 million. Nobody can beat that. But you know what? It's usually the third weekend of October. And this year I said, no, not going to do that. This is really not my job. This is a county's job. This is a city job, everybody's job. I did it because we bring our folks together. But I have to say no this year. So I'm not going to do it. So that means what? That a lot of people will go into the ED. A lot of folks will not have follow-up referral. You got sometimes to show some teeth. So that's the harm, right? So you don't always give things free to them. But we do serve everyone. And this is hard for us because in Frederick, Maryland, not like in Montgomery County and all that, you got, everybody so well, funded. I have really about 5%, 5.53% Asian, that's about 15,000 people. It's not a whole lot. But Chinese in Montgomery County, like 40,000, 150,000? Okay, it's a lot. So anyhow, but they love it. So you can see that diversity on my team. This is just last year's health fair. So case study, we did that, right? You have several case studies. When I talk about this, I want you to think about what went wrong to lead to that problem that we have. So you're going to tell me some problems from here, and we're going to talk about some solution. That's how I want to approach this. Right? Chinese restaurant couples come here 30 years old. I have a daughter, and a daughter's Tina. And all this time, first grade, just went to IEP and have 504, whatever. Oh, she didn't speak English, so that's why I put her in those kind of special program. Fourth grade, she said, I heard noises, voices, and someone was, beating me up. Actually, the child has been bullied, and nobody knew, right? And the parent didn't speak English. So one day, it really full-blown manifestation of schizophrenia, and we did not even know. And they called me up. I was right across the street. It was a Chinese restaurant. So I said, okay, let's just go to see. The doctor said the child already have 3 pages of suicide note. 10 days ago. 10 days. So that means that nothing being done by the school. I asked the father, and he said, yeah, the principal called him, but he couldn't understand what the heck is going on. 10 days, this child could have died, right? But then on that day, then, everything, really went wrong. And so went to emergency room and diagnosed schizophrenia. So the father, that was 4th grade, right? Then 2-3 years running around, I saw him cry, went to Brooklyn, went to this, the hospital, that hospital, couldn't really understand. Then the mother took her back to China. All kinds of, direct intervention, whatever. And the child is American citizen, and she doesn't speak, much the 普通话, right, to Chinese, but they speak Hokkien, right, Hokkien, so it's a different dialect. And also then the school cannot really accept her. So the father went to Guangxi, which is a western part of China, went to Shandong, which is the northeast of China, looked all over for herbs to help her. It was on my phone. And he called me, he said, Mrs. Chung, I couldn't take it anymore. And later on, he killed himself. So, and the daughter and the mother stayed there until last year, she came back. And then we'll start all over again, right? Homeschool, she couldn't go to school. So can you tell me what's wrong? What the heck is wrong with this case? Whose fault is that? Besides the language and the cultures. I want you to relook at the lens of the system, right? So want to do something? Want to do, that you talk a lot of, right, the situation you folks also have, but the system has a lot of issues. The community has a lot of challenges. So can you tell me, just please yell out, call out, because this is going to be sharing. What's wrong with the system in this case? In the first place, from 1st grade to 4th grade. What's wrong? Anyone? She's in school, right? She got parents meeting. She got interpreters. Then what? Parent couldn't understand. There's no follow-up, right? School is one system. Mental health another system. Family is another system, right? Healthcare is a system. Broken, fragmented. So what else do you think?
The parents didn't get care.
Right. The parents were.
The parents, the depression didn't get care.
Yeah, so, and also couldn't really know what to do, right? So it's a lot, yes. Exactly, stigma, right? So small town Frederick, not that small, second largest city, but we're the only Asian center in the whole darn Frederick. So it's just really hard. We don't have voices, in terms of voting, right? Yes, you do good. So go ask your delegates to give you guys money. We need to do that. So let's just go to what I printed out for you. So just look at the size of it, right? You know all the silos of the system, stigma, mistrust. We don't have much advocacy. We don't have enough desegregated data. And we're burned out. I am not equipped to do mental health. And people said, oh, wow, why are you doing all this stuff? Why not? Because when you care about a family, you care about them holistically. And one thing that I didn't hear people talking about today is social determinants of health. I'm a public health. So it's like if you don't have housing, how can you have stabilities in your household? Don't have job, right? Don't have, really the health insurance. All this is part of life. So we have to look at each of the system together. And don't let people tell you that you can't do this, you cannot do that. But how? She's doing a great job, in terms of parenting and so forth, but she needs the kind of support also, right? From the school, from the housing authority, from transportation. So we got to build our system together and not being siloed. So some of those are, in terms of the other side is somewhat the solution. I couldn't do all the job. Yes, ma'am.
I'm just thinking about the diagnosis for a 9-year-old of schizophrenia. Is a very, should be a very rare diagnosis for a 9-year-old, and it's not very common. So I'm just curious about all the things that the healthcare system missed to give such a harsh diagnosis.
I thought it was like in the teens, in the 20s, in the grown up, right? But then they said that, and we don't know, right? So it's really, and it's everything just so difficult for us. You got to understand, I'm running an agency. I don't have social workers. I don't have mental health workers. So I still have to help them here and there, driving them, right? Finding out, where to go. So you're going to help me next time. And also, Kate, that's what we need to hear to be, redoing after this conference. I really mean it. So again, then got me really into a lot of training, in terms of coming health workers into really culturally competence, right? And then trauma informed. What's the word trauma in your own language? Don't come and talk to me about the word trauma in Chinese. What does it mean? It's an English word. Yes, what does it mean in Japanese? No, Toru-san. Yeah? How do you translate the word trauma to trauma, right? And trauma is informed, trauma is response, trauma this, trauma that. It's hard for the family to understand the concept. So, and again, of course, the data. So that's really, you all know, the Vietnamese doesn't like the Chinese doesn't like, the Burmese. All of those really intercultural conflict that we have. We got to have good examples. No, this is one communities. And I always say there's just one human race. That particularly is so important. It's one human race that we are dealing with right now, not because you're black or white or yellow. This is a country that embraces that. That's our values of the country: liberty, justice, and for all. So next, then we do start doing a lot of work after COVID-19 or during that time. And just very quickly, so outreach definitely, education definitely, going to the Burmese church, having the Burmese doctors, going to the Muslims restaurant or the Middle Eastern restaurant and have them help us to really go to where they are. You all know all this; it's not new, but it is the relationship of the business and of the community's folks. I'm picking on Sue. Montgomery County is so nice that she's my niece, so I can do that. I'm hugging her. So they support a lot each other. But it's hard in smaller town, in rural area, in Washington County, in Garrett County, all those are rural area. So I said to them that, oh, really? You don't have minority? Do you have Chinese restaurant in your county? Yes, you do, right? And so how many people work in a Chinese restaurant? 4 at least. A cook, a front desk, and a server, right? There's got 4 families that you need to take care of. So don't tell me there's no Asian in your county. And we're not going to accept that. So next one. So this is a several kind of slides to share with you the how. And you all know that, but I'm going to give you some examples if that's okay. So again, do a lot of strategic planning. And this is the vice chair, Madam Vice Chair, right? So the AAPIs and commission. So bring those, organize those roundtables, for the communities, really develop training. It's very important. I'm still looking for this. So if you are a counselor, please come to us. I am a CHW training accredited. So we can ask you to help develop curriculum so we can train. We got to train those non-Asian, counselor. We don't have enough counselors around, bilingual, bicultural counselors. So we have to use community health workers. And guess what? We have Afghans, we have Ukraine, and they are doctors, they're surgeons, they have the language, they have this clinical skill. They just don't understand the American delivery system. So I trained them. Yes, it's hard. They are doctors themselves, and they came to this country, and now they start all over again. And we encourage them, right, to be like that. So resources and using, the really the example that we have. Next one, down from COVID, we do a lot of work. We have at that time we also got funding and with down with HHS, with HRSA, with that. Yes, know the game. 3 things you need to do: be very good at what you are doing, know the law, what the law says, civil rights law. So right now somebody doesn't even follow the law, right? So, but we'll continue to do that and get to the table where the money is. Those 3 legs do. Be very important. That's the how you do. Go rub elbow with the commissions. I serve on commission, that's what I can say. And using those, those opportunities to again leverage and also, really advocate other commission. So. I saw Kate, Kate's one of my grantees too, right? So I was the chair, the little 4-feet lady, chair the Maryland Community Health Resource Commission. Very proud, very proud, and I'm very happy to have my, not this governor, but last governor, appointed me as the chair. From $7 million, I advocate $155 million. And I want to make sure the money go into the community. So that's the thing that we need to do, the how. Be very vigilant about the political process. So, again, understand, all your every general assembly every year to go talk to your legislator, your own delegate, to say that what are the issues in your town, in your district, and push hard, right? Language access or cultural competency, the insurance and all of those that matter. But right now, you really have to integrate thinking about, a holistic approach to really address is, again, the workforce development. In my case, I have done a lot of 20-some years of social services, trying hard, you fall down, you stand up. But now that I'm really focusing on workforce development, economic development, integrating social determinant of health. We need to do that. And please put money into the communities, please. Talk to all these funders, right? So they say, yes, we do. So this is really, equity is not equality, please. Equality is sameness, equity is fairness. So just remember that. So don't, confuse the two and continue to really, all right, we have expert in here. Who I'm talking about? That's Dr. Frankie, you are the expert in this whole field. So I'm just learning. Okay, so next one. So again, to amplify the advocacy, thank you, Dr. Bouey, for inviting us to come and talk, and because really we have to continue to advocate, advocates in different level, so your mayor, your director of economic development, helping our small business to do well, helping them to look into healthcare insurance, helping them, to really have a holistic approach, taking care of the staff. Helping others, a nonprofit. We do that all the time, and when we have funding sometimes, I split them up. Like Stu was saying, it doesn't matter who get more, who get less. Thank you. She just wrote me a support letter. Kay wrote you a support letter. I wrote support letter to everybody. I just even write a support letter for them and sign their name with their permission. And they do the same thing to us, right? So sometimes don't let those barriers just say, oh, we can't work together. They don't have time, but they know that they will support you. So we work together with them. And what I do mental health is do a lot of storytelling and also data collection. Photo voices is a good one. So look it up. Have the young and the old to take, the camera, look at the screen, look at something, take a pictures and talk about. It is a skill, by the way. It is not just taking picture. It's a certain skill for needs assessment. It's a very powerful tool, photo voices. So that, again, where can you go for money to do photo voices for mental health? Folks, where would you go to get money for mental health using photo voices? Any place you want to go? How about your art council? Art, performing art, visual art, musical art, right? Those are healing process. Argue with them or to present to them, it works. All right? Taking funding. Nobody had done that, then you do it. Pet therapy, that's another one, right? Seniors love to have the pet, right? So think about different way, the how, bringing partner together. And Brother Ray, right? Yeah. That's it. So, yep, I love my, so I'm the only Asian Afro that speaks Spanish, right? So be genuine, be authentic to your other communities. Loving each other is really important, right? Learn about, the Dr. King story. Learn about the history of this country. Learn about the suffrage of the African American communities. Learn about your Japanese internment. Learn about your Chinese Exclusion Act. Learn about Vincent Chin. But learn about the success, of Ian Page or others, the Asian, scientists. And let them know that we are not going to take anything from you because this is my country, as I said to you before, right? Because continue to fight that. Stand up with each other. Really, everything matters. Everything matters. So collaborate with public funding. Again, if you are on the board, if you are on a committee, continue to advocate for everyone. So I know this next one, yeah. Not working?
No, it is really
Oh, okay. This is very important kind of picture to show you. Even the little kids during the time of anti-Asian hate, this is Hispanic kid. They come out to the mall, standing up, take pictures with me. We have a photographer, coming with the kid to write down something and then take pictures with them. How do they feel? It's very important. So he says something like being a different race doesn't mean that I something difficult expectation. And that's another one talk about, being Asian doesn't mean that I bring, COVID to this country, right? The kid being bullied. And then oftentimes they talk to a parent and parent could not even address that. Because they said, okay, just be quiet, right? As you said, be quiet. So, and that first, the green one is really our immigrant mental health, immigrant youth mental health. And it's so powerful. In the middle, then we have a pastor, Sally, help her to facilitate, talking out loud about issue. Not just the Asian kid, but other minority kids. That's what you said, right? They came to you, they said, it's no different. We're going through the same thing. So empathy, commonalities, togetherness. And that's where you build a string of solidarity to fight the system. Oh, I'm not anti-system. I love the system. I just don't want to be working for them. I want them to work for me. Next one here. So this is what I'm hoping that we walk away with today. And if, Dr. Jennifer, you can help us looking at really, collaboratively, right? Looking at dashboard, looking at, really, way to create, it's just important for the dashboard, in my opinion, the demographic, how many in Virginia, how many in Maryland, how many in DC, what are the top issues? Is it, the 14 to 18, as Sue said, the highest, suicide rate. We have 20% of 18 to 24, 20% of those in AAPI, they're voters. 40% are the 45 and older. So they are the voting bloc. Educate them. So do research project. Please, work with your academia to do research project. It's right there. So just offer to them. I can help you. I know we have the community in my backyard. I'll do survey with you. I'll do research with you, but with money. Don't do things free. And let them know that you're going to put in line item. Community engagement, participation, gift card, transportation, childcare. And for those who are in Maryland, how many of you know about the Enough grant? Enough in Maryland. You know that? So engaging neighborhood organizations, unions, ENOUG, government and household. This is the latest legislation by the governor, and he's putting in hundreds of millions of dollars. So even it is for poverty, childhood, I'm sure, right? Our AAPIs in that category. So don't just step away. We're not poor enough. No, expect to be part of it. So next one, I think that's it. I think that, the call to action is want to have mental health group. I want to just share best practices. We heard a lot today, and get into politics, write letters, do research. 3 T's, please. Time, treasures, and also, talent. That's the criteria for board members. Serve all kinds of boards, all kinds of the committees. So I hope that is my heart, and it's kind of working for the last how many years, decade, but it's still more work to be done. So I just want to say thank you. I know the time's up for me, and we're not able to show the slide for you, but it's just I love what I do, you can tell. I have all the wonderful staff working together, right? Thank you, Jennifer.
Thank you so much. Thank you. Yeah, Lotus talked about we should do research, we should fund, we should work with community. That's what I've done for almost 30 years. But my experience is the best. What's the best project are the communities are funded. And then they come to us to say, researcher, you help me do some numbers. Why? Because I found if I do numbers and I publish a paper, no one look at it. Right? And if it's come from the community, then these data can go back to the community. And they are so creative. We see the videos, we see all the social media, and they know the best way to engage. So as researchers, we think that we should be of service to the community. So our last but not the least group presentation is from CCACC. So this is referring to the Chinese Culture and Community Service Center. So you already heard Kate, the name. Kate, thank you for coming. I know you're very busy, and she's the director of the CCACC Health Center and has led CCACC expand the Pan-Asia Volunteer Health Clinic since 2011. I have to thank to you, some of our Georgetown University undergrad students actually goes to your center for interns. And you are a licensed clinical social worker, and you also work with the center addressing medical, psychological, and social needs. And along with you, we have the Dr. Xiaoping Shao, who's a psychiatrist and worked many years for the VA, but she's also worked over 10 years at the CCACC as a mental health counselor and volunteer. And you built a Mental Health 360 project 10 years. And this project has contributed to many of to improve the resilience in mental health program. So please come up, and we'd like to hear from you.
Thank you so much for inviting us, and so good to see some old friends and sister, brother, and everybody here. And I think we have a great Asian American community service group, and we support each other, KCSC, AACF, and Georgetown, and Cash. So we are tiny, but we are mighty.
Yes, good afternoon. It seems like we will be between the talk and I'm not sure the break or not, but I feel I have learned, I think Kate also feel, we have learned a lot for listening to the speakers. And I think this is possibly a tall order for us to keep this kind of energy after Ms. Chung talked. This kind of level of energy, I don't know if we'll try, okay? Yeah, that's a tall order. Yeah, and
I just learned let's do this. Let's do a W.
Okay. Okay, stretch. Yeah.
Let's do a Y.
Okay.
Hold on 10 seconds. How do you feel? Good. A T.
Reaching to the sky.
A T. Yes. Okay. If you need it, just do it.
Thank you. Thank you. Yes. And also we heard, so much, and we would like to have a funding. We have the people, we have the manpower, we need understanding and break stigma, a lot of things. And also we would like the government or society to recognize us and help us, support us. But boiling down, the end is when we start and who will work on it. And we'll say not us who, not now, when. So that is the time we do it. And I think CCACC did a great job. And I would like Kate to introduce you CCACC and also our health center.
Yes, so we are at Gaithersburg. Normally depends on when you travel. My husband take 1.5 hours to come to DC to work. And normally it would take me 40 minutes with traffic, and today I sprint here, so it took me 30 minutes. So it's very close in Gaithersburg. So this is a little history of the platform that we landed, Mental Health 360. The Pan-Asian Volunteer Clinic started 2003, started as a pop-up clinic for 15 years at least. So we piggyback with other community clinic and just operate one afternoon a day until 2016. We have our own tiny office with 13 square feet to provide, for a long time. From 2016 to December last year, we moved to an 8,000 square feet facility. Yay! Come to visit us. I guarantee you it's worth a visit. I extend the invitation to all of us to see how this works. But it really comes a long way. And we're going to have a gala soon in May 16. And I'm making a video that is called A Long Way to Come and A Long Way to Go. So hopefully we can all see everybody here. So that marks the journey. I want to mention 2020 and 2023. It's a very extraordinary time for everybody, but it's especially for us as community healthcare clinic. So at that time, I only have like five staff, and we all remember those days, right? It's not too far, and everybody closed the clinic. Even the commercial doctors, they closed their office while we stay open. We learned to test people, give them a COVID test. I was the one testing the first positive test. I have to do it, otherwise my staff would not do it. It's so scary. So we give testing along the way. We give COVID vaccine. We are the first community center to give vaccine for Montgomery County's uninsured, people who have difficulty access vaccine. And we were the only one to do it for 10 solid months until the other community catch up. So it takes a lot of effort, and it takes a lot of advocacy too. We go up to the county and tell them we can do it. We have 150 licensed vaccinator, RNs, MDs, pharmacists. They said we want to do whatever we need to help the community. So I have a list of 150 volunteers professional ready to serve. And I have another list of 3,000 community senior. They have nowhere to sign up for the vaccine. Remember the beginning, only the 75 year above can sign up the vaccine, and they have to do it through the website. They have to jump through all the hoops to get the vaccine. Everything is ridiculous. So we call everybody, we send out a link, and everybody sign up. So we give the 2 lists to the county, and the county say, hey, we just try you out. And that's how we started the service. And we vaccinated more than 10,000 people in the first 2022 while we first had the vaccine. So that's an example how we work. And mental health is nothing easier than the COVID. I am a clinical social worker since 2007. For a long time, I think there's no way to do mental health in Asian community because we just don't have that kind of problem. That's what people tell me, right? We just have people committed suicide. We just have people have a lot of broken family because they don't understand each other. We just have hiding. I have a daughter on autism. On the spectrum autism, and people just come to me. Why do you talk about that all the time? It's a shame, right? We hide the problem in the closet, so we don't have any mental health problem. So for a long time, I think there's no need for any mental health service until Dr. Shao come up to me with a group of volunteer doctors. They say that we need to do something about mental health because they see a lot of people with medical, they ask for medical visit, but the root is mental health. A lot of somatic symptoms, a lot of things that would not get addressed after the medical exam, and they use up a lot of public dollars in the ER because they keep going to the ER for nothing. So Dr. Shao and Dr. Chow, Dr. Lee, Dr. Mark Lee, we all formed this Mental Health 360 program, and we do a lot of education for a long time with virtually, because if we do it in person, nobody will show up. But virtually, they can turn off their camera, they can listen from the beginning to the end. So gradually, people understand, and gradually, people accepted and use service. One example is I'm also the social worker for an adult daycare center, and I just the psychosocial and just mental health. And at the beginning, I have students actually from GW and UMD social work school. So my social work school student intern tell me, people go past me, avoid eye contact with me, because when I look at them, they know I got a problem. So that was, at the beginning, it was like that. And nowadays, I have senior talk to me, when is my time? I need an appointment to talk to you. When is my turn? So this is all real. So we are very happy that in a small circle, we are changing the climate. Yes. So we talk a lot about the stigma, poor mental health and crisis. I hand it to Dr. Shao. Dr. Shao is also a very senior clinician to deal with all kinds of mental health problems.
Okay, so yeah, we already we heard so many, almost like we read yours mind. We just listed a summary here about the keep silent and not talking. Kate already mentioned, yeah, and again, just to see people always come to the primary care physician first to talk about their mental health issue for the 2 reasons. First of all, a lot of the Asian American people have somatic symptoms. The headache, upset stomach, instead of they come as, oh, I'm depressed. And and the second is a stigma. Nobody wants to say I'm depressed. It is okay, say I'm sick physically. Yeah, and it's I'm weak. Consider depression as weak. Yeah, so this is actually just the piggyback. Kate said 350 mental health 350. It's not from me. It is from a group of community primary care physicians. They saw in their primary care so many mental health issues. So they are the driving force, and I am just one of the consultants. Yeah. Okay. And as we all know, the challenge, we already heard about the bilingual and different culture and all of these. So based on all of these, we have a mental health 360, and this is a very bold name because 360, basically you have to cover all different direction and also try to cover the different age spectrum. Yeah.
And as someone asked me, 360 means go nowhere. You can be like that too.
Well, we will see. Yeah, so it is this one. Yeah, okay. Okay. Yeah, so this is, we all know for mental health, there are barriers, cultural barrier and structural barrier in our community. Cultural barrier, like mentioned, stigma and feel shame if you have a mental health issue. And the second is believe that depression and anxiety are personal weakness. You're weak. Yeah, you just go to get yourself strong. Yeah. And also the emotional inhibition rather than expression. That's our culture. Our culture, I mean, more Asian culture, it is more like a submissive and the people just, if you have something, take care of it yourself. And yeah, like in that way. And also lack of trust in mental health professional. And yeah, so how much they know and if they will, usually if they will tell other people about that, they worry about, we are such a close, small community, they worry about that. And structure-wise, we lack of structure competent providers. I mean, we don't have culture competent, which means we don't have that many people know the culture that much. And but we do, but not that many. But yeah, and also bilingual and access and transportation costs. You have insurance or you don't have insurance. And another interesting thing is model minority. Like we consider ourselves as a model minority. We know everything. We take care of everything. We do not ask government funding to do anything. We get things resolved within us. Yeah. And okay, so yeah, that is the major barriers for the mental health care in our community. Okay, so this is our mental health 360. And yeah, looks like, so it is, you can see the started from middle. That is started in actually in a shopping mall. A group of primary care physicians, psychiatrists, and Chinese school, principals, and social activators, and the church leaders. So like in the same culture, we just sit in their food court and discussed about that. And, yeah, after snow that day, I still remember. And that just, the birth was from there. And yeah, because the reason we are able to make it is because we know we have unmet need for mental health. The challenge in primary care clinics, people come, so many mental health issues, they come just ask for primary care. And also immigrant family, we have cultural gaps, and the parents, 3 different generations live together, they have different culture difference a little bit, yeah. And working with chronically ill senior Asian immigrants is also challenging. We will cover that, yeah. In order to do that, that's why we got so many people collaborate to try to cover the whole community. Okay, so this is our, that happened in March of 2015. That is 360 started. So that is a 10-year journey for us. So what we have done, we enhanced awareness. By doing so, what we did, in the beginning, we said, people don't want to talk about mental health, hush hush. They said, well, let's do it. In Chinese newspaper, we asked for the article competition about mental health. So yeah, we received like more than about 50 or something. Yeah. 30, yeah. And we give them different prize, and yeah. Yeah, money always we do have. Yeah.
They give you the dirty secret.
But this is the beginning part. The community start to talk about the mental health, normalize the issue. Do you feel shamed if you have high blood pressure? You don't feel shamed. So this is the same thing. So we do that. And also we encourage, because we see the cultural gap, we did a program called Hear Me Out, which is between parents and children, write open letters to each other. Because parents and children have different culture. I mean, my personal example, my daughter come home and say, Mom, other than you ask me, have you done your homework? Anything else you want to ask? Yeah, the Chinese culture, always academic success, the pressure in that way. So, do you forget to ask me, how are you? Yeah, so that's why we ask them to write open letters, and we received many letters, and we, based on the letter, we said, well, we can take to the next step. And many parents said, wow, we don't know, our children don't like this, don't like that, what do we do? And then we integrate. We got University of Maryland. We have a professor work in psychology and education. So we started parenting workshop and parenting kids connection, something like that. Yeah. So so all the purpose is to reduce the stigma. In order to reduce the stigma, what we have done, and we make our clinic integrated. Yeah.
So the clinic actually is a medical clinic, so we provide primary care and some specialty on site. So each visit we ask for the PHQ and GAD. So we just screen right there. So nobody can escape. It's just a normal thing to come through.
Yeah, just in case you don't know, GAD is for anxiety screen. Yeah, PHQ-9 is for depression screening, basic. Yeah. Okay, so this is the structure of our clinic. We start from primary care, that is on your right side. On your right side is the primary care. So they do the screening, depression screening, and at the front desk, and the primary care visits with primary care providers, counseling and treatment, primary care visit. And so usually in our culture, we don't like medication first. If you have a mental health issue, always, I don't think it's only our culture, many cultures, yeah. So why we need that, yeah. So usually we get all the primary care, get your physical issues taken care of, usually what I get, and then we get people to do the psychotherapy. And I heard in this afternoon, we just don't have enough therapists, we don't have enough counselor. I think our clinic creatively trains some people. Would you like to?
Yeah, so it's actually a different tier. So Dr. Shao is a psychiatrist, and Shaba is a psychiatric nurse practitioner. So she has much more availability to prescribe. And myself is a psychotherapist, and Dr. Zixin Huang, Dr. Shao just mentioned, is the UMD professor, but she is trained by psychology. So she can provide a little bit psychotherapy for teenager and sometimes their parents. So with that, those are like credential professional for mental health professional, and all this actually is next level ground worker. They are all public health students, and she's a counselor intern with me, and she's actually a social worker. So we have a team of on the ground worker that serve the mental health purpose. Of course, we cannot bill for those, but the efficiency and the efficacy, it's just exactly like a clinician would do. It's just the companionship and the active listening work. And those are the primary care doctors, and they are very much aware of the mental health need of the patient.
I understand that we need the speed. Okay, so yeah, I'm reminded. Yeah, so this is just, if you're interested, you can look at our slide in the future. That's our parenting workshop. And yeah, next. And this is before the workshop, after workshop, what is verbal hostility, how the parents talk with the kids, after workshop reduced, and punitive parenting before is higher and afterwards is lower, and parent warmth, and also, directiveness and shaming behavior. So this is, you just look at that. Yeah, okay, next. Oh. Yeah.
Another chance.
Yeah, so that is, we all know culture difference because our brain is wide with culture and with our language. So we need to rewind, we need to modify, we need to do a lot of things. So these are the, work we have done. And I will give this to continue for next speeding.
Okay, speedy. Yeah, so I guess achievement is we make mental health not an issue. It's just in our daily operation, in our visit, in our medical visit, in our social determinant of health visit, because we do have a SDOH program to help people to sign up for insurance, troubleshoot for food security, housing. And with that, you can imagine mental health is in it. So it's all integrated, so we address the stigma problem. And this afternoon, I'm going to lead a diabetes self-management workshop. It's an evidence-based workshop in Chinese to 20 senior over 80 years old with uncontrolled diabetes. We still have spots. So for a long time, we do the English one because we have to keep the fidelity, and no way we can do it in other way. But nowadays we can do it in Chinese, and that make a huge difference on the outcome. So I will spring back to do the workshop at 3:00. But this is just one example. We integrate mental health into whatever we are doing, into the medical. So stigma would not become a huge problem that would prevent people to seek out for health. Also, I mentioned before, the disability community, it's often unseen and untalked about. And so we do some work to provide service and support for the family. So it's all in the little book. You feel free to keep them. It's our annual report card. The more people know about it, the better. So feel free to bring it. Do I have time for a success story? No? Okay, no. Okay, fine. So this is a very interesting case for everything. One story, can I? A very interesting story, I promise you. I just see this 40-year-old gentleman with reporting complaint, all kinds of pain all over him, cannot sleep, hearing voice, moving from apartment to apartment in the past few years. And so he come on in, talked to me, and he did reveal that he has some mental health issue, has hospitalization, and he's open to seek help. So I refer him to our psychiatric nurse practitioner to get some medication to calm down the system so that at least he can sleep, at least he can live. And then I refer him to the occupational therapy across the street because he mentioned he feel that his muscle is losing and his body is sucking into the chair. So I refer him to occupational therapy and get some training and get the muscle up. And so he's taken care of. And of course, the next day I got an email from DC pre-trial court that he actually have some legal problem. So of course he did not tell me at the beginning. But so we are not afraid of helping people with all kinds of problem that he actually running from different people and get help and nobody would take the case. So just one example. We all need that. And we all need you, everybody, if you want to do anything fun. I am looking for interns and pre-med students and just come on in if you have 1 day a week in your semester. I am actually the field instructor for University of Maryland. and GW. Georgetown, no one approached me yet, but I'm open to it. All right, thank you.
Yeah, we used to have the community organization class 1 day a week, but now we don't have that. Well, I'm amazed. We are almost 2 hours, after the lunch, and I think that the energy in this room is still high. Thanks to, I think, every people who come up, you can feel their energy, their passion, and their interest. I would like to, we only have 10 minutes before our break. We got 10 minutes break. I would like to welcome everyone to the front, our speakers, and so that we can answer some of the questions in the audience. Would you like to? Please come up. I was going to ask everyone to give us what is the scenario. Tell us what moment is most, I think you're doing an amazing job and you're passionate about it, and also you put in a lot of energy and sacrifice here. So I was going to ask what is the best moment, but I don't think we have time for that. But with that, see, you're the stars. Everyone done to take pictures. Any question from the audience? We only have about 5 minutes, actually. So as people are preparing for that, anyone wants to volunteer to tell us, do you have a moment that you treasure in your work that make you really happy? Just tell us one.
I really a lot. That's what actually keep me going in this work. It's not paying in dollar sign, but it's paying in a lot of spiritual and psychological reward. One example would be I have a 90-year-old senior who has been jumping around like anxiety her whole life. And so staff, the adult daycare staff noticed a huge change after she settled down and talked to me weekly. She's not doing that anymore. And she was like telling people, just sit down, deep breath, everything's gonna be fine. So she's become a mentor for other seniors. So I think that's cute.
All right. Any questions? I have one in the back. Yeah.
Hi, and thank you so much. This was beautiful. I actually work in Hagerstown with Elizabeth, who works in Frederick, but she sent this to me and I was kind of contemplating. And I said, let me come. And I think I made a good choice, to come. Again, coming back to your story, when I started working for this organization, AACF, Asian American, I told a friend of mine, hey, I'm going to work for this organization. And he asked me if I actually took time to look at myself in a mirror before. Yeah. And I wish to really invite him here today so that he could see that, I didn't make a mistake coming here because it's about everybody. I'm an immigrant myself and I'm happy to be here also working I'm African, and whatever is happening within the Asian population is also happening within the African population. And most of the time we ignore those because we are working so fast to be accepted in the American culture. And down the years, we have realized that so many immigrants population, especially the youth, are getting into suicide and all of these things. Why? Because of many factors. One of those factors is the fact that when we leave our countries to come here, everything seems okay at home. But when we come here, there's a problem. So that means that when we get here, there's a kind of disconnect within the family. And we seem to ignore that because everybody wants to speak like American. You want to have the accent. And many teens have that because at school, when you don't speak like an American, you are being bullied. So I feel like you guys do a lot of work with families. So how do you do to address that, to help those families unit not to be disconnected? Because I believe if there's strong connection at home, it's gonna follow. So how do you do that to help? I work with AACF and they organize all of these events, with Asians. They are very fancy and I got a chance to participate. That's beautiful. But I just wanted to hear a little bit more if you have something going on towards that direction. Thank you.
I think that's one of the reasons, what you just said, is one of the reasons why we incorporated more mental wellness for parents. Even though we're a youth organization, what we were finding is that when the youth went home, the parents didn't understand. The youth are very connected to our staff. So our staff is sort of their go-to because they build that relationship. They're also very connected with their friends. But when you go home, there isn't that connection. So I do think it is an entire family approach that's really, really important. And I think that we need to continue to do that work that way versus the isolation of just the youth or just the parents. I actually really like the idea of the open letters. I think that's a great way because letters is a great way to express without that mode of saying things and people feeling hurt, but just kind of getting that out of your system, regardless of what the other person's reading or hearing, it at least gets it out of your system. So I picked up a lot of good tips here today, too.
That's great.
I just would like to share our experience to build the relationship in family settings because we are moving toward the 50 more years in the future. We are reforming our mission and vision. Previously, we more focused on the first generation of immigrants, that's their seniors. But we observed many youth mental health arise in the community. So last year, we relaunched our youth program with the mental wellness approaches. So as we shared, often the families and parents want to hide their mental issues. So we didn't promote our program as a mental health program, but rather than say mental health program directly, we introduced this is just a youth group to have a cultural connection together. So fortunately, we do have a lot of events throughout the year, health fairs and vaccine clinics and educational sessions and senior seminars and workshops. We invited the youth volunteers to support the event. So this volunteer opportunity is not to open public. We just formed the first cohort, the KCSC youth group. So as a group of 80 middle school and high school students can get together often to support events or the seniors in the community together, and they build their relationship. And Asian moms always support their kids. So during the giving a ride, they start having conversation with the kid. And they found the topic to have a conversation with the kids after the event. How was your work at the event? And they share the feeling and what they learned through the volunteering. So it kind of start to build their relationship again. So I think this was a good approach to build their relationship again.
I think I'm going to get Julian. He's only about 3 months with me, right? Now that this is your next project. Okay? So, no, seriously, I think that for the researchers, think about what I'm listening right now is that, right, I'm really long time ago, old peoples right now. So the new generation of immigrants is different. So I think that we need to recognize that, right? We came in the 70s, those came in the 80, 90, or 2000 or 2010. So those new generation of immigrants, down the next generation after them, I think it's going to be different in terms of intervention because, right, the technologies and your thinking is so much different. I was coming up and I said to share, saying that, oh, my father wouldn't want me to have, an American boyfriend because it could be United Nations. And that was 55 years ago, right? And he would disown me or whatever. But now it's changed. So think about that. So I think that some research need to be done, to demonstrate that the new approach is needed. And then really having parents, program or youth program. That's why we want to focus a lot on the immigrant youth. So that is your next project. Okay?
Actually, this is a great segue to our next panel, which is the youth panel, that we will hear from high school students and college students from, I think, 3 different entities. But first of all, thank you so much for